I'm Allie. I'm going to be your nurse today. How are you?
Terrible.
Okay. I'm going to insert some patient privacy for us here. And today we're going to do a full head-to-toe assessment and some vital signs on you, if that's all right with you.
Perfect.
Okay. So, first let's start with some hand hygiene as well. And I'll start with a general survey. So you're sitting upright, you're awake, you're alert, talking to me. You don't have on any shoes, but otherwise you're clean and well kept. Do you know what year it is?
2020.
Do you know who the president is?
Trump.
Do you know where we are right now?
Fail.
Okay, so you're oriented as well, you're willing to maintain eye contact with me, and your skin is darker, showing that you've been out in the sun as well, which is good. So I'm going to clean my equipment first. Are you having any pain today?
Yeah, my right foot.
Your right foot? How long's that pain been going on?
Well, I went to a circus yesterday and I got stepped on by a zebra
Wow.
because the giraffe was chasing me.
Okay, so describe that pain for me. Is it sharp, stabbing, pain?
It's probably a 10. Also have no feeling in my foot.
You have no feeling? And you rate it at a 10 out of 10? Describe the pain for me.
Sharp, dull, stabbing, aching.
Just a lot of pain, huh? Okay, so does anything you do make the pain better or worse? Okay. Alright, we'll get that checked out for you as well. So I'm going to go ahead and assess some vitals on you. Go ahead and go ahead and relax that arm for me. Brachial pulse is present, which is good. Go ahead and assess radial as well. So I felt that pulse rate at about 70 beats a minute, which is normal. So I'm going to go ahead and take your blood pressure. So your systolic threshold was at 130, so I inflated the cuff to 160, and your blood pressure was 136 over 84, which is normal as well. Great. So I don't have a pulse oximeter, but if I did, I would just go on your finger and I would it would tell us how much oxygen saturation is in your blood, which at 100% is normal clearly, but it typically can range from 93 to 100. And your respirations are at a 16, which I counted while measuring your pulse rate as well. And I'll take your temperature, which is 97.8, which is normal as well. So we'll go ahead and go to the head to toe, if that's okay with you. Alright, so I'm going to start with your scalp and palpating. Let me know if there's any tenderness or pain when I do this, okay? Is this normal hair distribution for you?
No.
No? What's different? What's not normal?
I used to have hair.
Okay. How long has that hair loss been going on?
Since I was 12.
Okay. So, got some alopecia going on here. But other than that, there's no lesions, pests, or bumps or bruises that I can note. Okay, go ahead and stick your arms out for me and cross them. You can relax them. You don't have to stick them out. But I'm going to palpate like this. You have normal hair distribution, and your skin is pink, warm, and dry, which is normal as well. Same with the legs. Hair distribution is normal as well. And it's a skin turner right there and right there, which is instant, so you're well hydrated as well. And if you like her to stick out a hand for me, I will touch your nails. The color is pink. The consistency is smooth. There's no ridges or grooves to note, and the capillary refill is less than 2 seconds, which is normal. Go ahead and make a heart for me with both hands and an infinity streak. Alright, great, and there's no clubbing there as well. So we're going to go ahead and go into your head and neck, and so I'll start with palpating your temporal arteries. And both are palpable at a +2, which is normal. And I'm going to do carotid as well. Those are a +2 bilaterally as well. And I'll also listen to those. And these are normal as well. So I'm going to go ahead and palpate your sinuses. Let me know if there's any pain or tenderness as well. Frontal. No pain. Okay. Maxillary. No pain there as well. Okay, great. So, and now I'm going to go ahead and have you smile for me. Frown. And puff out your cheeks. Okay, great. So the face is symmetrical, which is normal as well. So now I'm going to do your lymph nodes too. So we've got preauricular, postauricular, occipital, submandibular, submental, tonsillary, cervical chain, and supraclavicular. No pain anywhere there as well? Okay. And so one more thing, I've got to go ahead and open your mouth for me. Bite down and clench. Okay, great. So your respiratory strength is good, and cranial nerve 5 is also intact. And lean your neck up just a bit for me. Your trachea is midline, which is normal, and go ahead and swallow for me. Okay, great. And so now we're going to go ahead and move on to the side. Are you all right? Here's a drink for you, and I'm going to palpate right here. Go ahead and take a drink for me. Okay, and another one. Okay, all 4 lobes of the thyroid are non-palpable, and which is normal, and your ability to swallow is there. So cranial nerve 9 and 10 are also intact. So I'm going to go ahead and start with the eyes. Okay. So go ahead and just look at me. Open. Sclera is white, which is normal. The conjunctiva is pink and moist. There's no drying of the eyes. And the lids are also normal skin color. And good to go. So now I'm going to have you hold this just a little bit out from your face, right around the foot, okay? And pick a line.
Around my foot?
Right around the
around 8 foot.
Yes, correct. And just go ahead and pick a line and read it for me. Cover one eye first, though.
63, 92, 5.
Okay, now the other one.
37, 42, 58.
Okay, great job. So cranial nerve 2 is intact as well. So now I'm going to have you just look straight forward at me and follow my pen, okay? So we're going to go in with your eyes. All right. Okay, great. So cranial nerves 3, 4, and 6 are also intact. And so now I'm going to test your light reflex. So look straight at my finger. Okay, corneal reflex is noted in both eyes, which is normal. And look straight forward at me again. Okay, and pupils are equal round, reactive to light and accommodation, which is normal. Alright, and now we're going to go ahead and move on to the ears. So let me know if there's any pain or tenderness when I twist outside of them. Any pain? Okay. Any pain there? Alright. And I'm going to do a whisper test, okay? So I'm going to whisper 3 words, and you just repeat them back to me, okay? So we'll cover one ear.
Possum chicken dog.
Okay. And we'll do the same over here. And nugget.
Chipmunk nugget cat.
Okay, great. So cranial nerve 8 is also intact. And if I had an otoscope, which I don't, we assessed in lab, I would look at your internal ear, tympanic membrane, and it would be gray and pearly if normal. Okay, so now we're going to go ahead and go to nose. So immediately I can notice that the septum is not deviated, it's midline, which is normal. Go ahead and look up for me. Alright, the nares are painted, they are pink and moist, which is normal, and the hair is distributed normally. So go ahead and cover one for me and breathe in and out. Okay, another one. Okay, great. And so now I'm going to have you close your eyes and smell for me and tell me what that smells like. Okay, good deal. So cranial nerve 1 is also intact. So now I'm going to go ahead and go to the mouth. Can you say light, tight, and dynamite for me?
Say what?
Light, tight, and dynamite.
Light, tight, and dynamite.
Okay, good deal. So I'm going to go ahead and assess your mouth. Go ahead and open for me. Okay, so hard and soft palates are intact, pink and moist. The uvula is able to move back there, especially during that yawn. So cranial nerves 9 and 10 are intact. Go ahead and stick your tongue out. Move it to the left. Move it to the right. All right. Cranial nerve 12 is also intact. And I'm going to pull down your lip just a little bit. And the gums are pink and moist, and teeth are white, which is normal. And your lips themselves are not dry. There's no cracks or anything like that, which is good. And open real big for me and stick your tongue out. The tongue is dark pink and moist, which is normal, and the tonsils are present, but they're close to gray, which is normal. Alright. And so we're going to go ahead and go on to the chest. So go ahead and take a deep breath for me. Okay, chest rise and fall is equal, which is normal. And if you wouldn't care to sit up for me. And I'm going to listen to your lung sounds. In and out.
Just a burp.
In and out. Again. In and out. And again. And again. And again. And one more time. Okay, so those lung sounds are clear bilaterally. And go ahead and take a deep breath for me. Alright, and chest is equally rising and falling as well in breath. So you can sit on back for me. Alright, and I'm going to go ahead and listen to your heart, alright? So we're going to go ahead and go right here, and that's the aortic, and S1 and S2 are present. Pulmonic is present, S1 and S2 as well. Erb's point, S1 and S2 are also present. Tricuspid, mitral, which is also your apical pulse. So I'm going to listen to this for a minute.
good. Change more faster.
Okay. This was 68 beats a minute. I'm going to right here for maximum impulse. Okay, let's see another slot. And if you wouldn't care, I'm going to have you lean back for me, alright? And if you wouldn't care to sit up on your side and hold yourself up with that elbow. Thank you. Okay, and I'm putting maximum impulses palpable as well. Alright, you can sit back up for me. Yes. Good. Okay, and I'm gonna go ahead and assess your other pulses as well. You okay?
Yes.
Okay, so we're gonna go right here. So this is popliteal. Posterior tibial. And dorsalis pedis are auto +2 bilaterally, which is good. There you have no edema, so we'll grade that as a 0 as well. Alright, we're gonna go ahead and move on to the abdomen. So I'm gonna lay you back again. Okay. Alright, so the abdomen is flat and equal on both sides. There's no distension or any abnormalities that I can note presently. So I'm going to go ahead and listen to the abdomen. Okay, and bell sounds are present. So I'm going to go ahead and press as well. Okay, and there's dullness in the right upper quadrant and tympanic and all other quadrants which is normal. And I'm going to go ahead and palpate all 4 quadrants as well, okay? Let me know if there's any pain or tenderness.
It actually hurt a little bit like right there.
Okay. Have you eaten anything?
Wow.
Have you eaten anything? No? Okay.
That hurts.
Alright, and so that was normal, only a little bit of pain right there, right?
Yeah.
Okay, so now I'm going to palpate for the liver as well. The liver is non-palpable, which is normal. Come on, we can go ahead and sit you back up. Alright, you good?
Yeah.
Okay, so let's go ahead and move on. So I'm going to have you close your eyes for me, okay? And tell me if this is soft or sharp.
So,
Okay?
ow.
Does it really hurt?
Yes, that's
Okay.
sharp.
Okay, that was sharp. Good job. Close your eyes. How about now?
So,
Okay? Okay. Good deal. Alright, and now you can open your eyes. Go ahead and look up for me. Look down for me. To the left. To the right. Okay, range of motion is good for your neck. And we'll go ahead and lift your arms up for me. Okay, lift your legs up. You can put your arms as well. Okay, go ahead for that one as well. Alright, and grab my hands and squeeze them as hard as you can. Alright, strength is good, no weakness there. Alright, and go ahead and push down for me. And up. Again. And up. Okay, no foot weakness as well. Can you touch your heel to your right heel to your left shin? Okay, and your left heel to your right shin. Okay, good job. Shrug your shoulders for me. Alright, cranial nerve 11's in 10. And take your finger,
Which one?
either one, and touch it to your nose. And your other one, and touch it to your nose. Okay, good job. And go ahead and lean up for me. I'm going to palpate your vertebrae as well. Okay, so we've got cervical, thoracic, and lumbar. Any pain anywhere?
No.
Okay. All right. You can sit back for me. All right, and I think that's it. We're good to go.
Thank you, Nurse Allen.
Thank you for being my patient today. I appreciate it greatly.